Once the patient has been treated conservatively, and this can include bracing, anti-inflammatory medications, time for natural healing, and physical therapy, I'll frequently see the patient back again in approximately 4 weeks after the initial evaluation. At this particular time, most people are getting better treated conservatively. At this turn of event of the 4 weeks, we have really obtained the MRI, the CAT scan, or the appropriate radiograph to help with the diagnosis and also with the treatment plan. If the patient is failing the conservative care, very frequently in knees and also in shoulders, we would perform a cortisone injection to try to decrease the inflammation. Now, it's important to realize that cortisone itself is a chemical anti-inflammatory medication that is based to improve and try to treat chemical inflammation, and this would be tendonitis or bursitis or along that region. It does not change a mechanical problem, such as a torn rotator cuff or a torn meniscus in the knee. By injecting the cortisone, it cuts down the inflammation and also aids with the healing. But frequently, the actual tissue itself does not complete healing, or it reaches a point that has tried to heal as much as it possibly can, and it has reached a point that is no longer healing, and there's still complaints of issues such as limited range of motion, stiffness, soreness, sharp pain or dull pain, or limitations as far as the patient's quality of life, such as when they're ambulating or when they're sleeping. When this happens, we start to discuss operative intervention. I usually explain to the patient at the first meeting and outline the non-operative to the operative treatment plan. The initial events are always non-operative. Once the patient comes back in their second or third evaluation, they're actually seeing whether or not the actual non-operative treatment is helping the patient. If they're doing good, then we don't worry about the patient. They go on their way and they have no problems, and they'll follow up as needed. If they reach a point that they're reaching the failure of conservative care, that is when we start discussing the surgical intervention, and this can be in the form, for shoulders and knees especially, in the form of arthroscopy.